two, and one. Pak Dino.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. This is Dino Patijalal. I'm the founder of Foreign Policy Community of Indonesia, and I'm welcoming everybody who is joining us today for a very special discussions that is hosted by FPCI and 1000 Abrahamic Circles. And the title of today's talk is Keep Her in Your Prayers, Why the Involvement of Religious Leaders and Organizations Matter in protecting and empowering women in society during the COVID-19 situation. I must say this is a delightful occasion for me because just 2 days ago, I was in a webinar hosted by FPCI, and it was all male lineup, right? And I felt so bad about it. I said, what happened to the woman in this lineup? And apparently the two of the women that we invited were not able to make it. But, I got quite a bit of flack for it. And now it's totally the other way around. I am the only male in a discussion that is all female. And it's a great thing. And it, it's taken a lot of effort to put this together, and we have been able to identify and invite a number of good speakers. We have Dr. Livia Iskandar, who is the chairwoman of Indonesian Agency for Victims and Witness Protection, LPSK in Indonesian. Rahmawati, Ibu Rahmawati Hussein, who is the vice chairwoman of Muhammadiyah Disaster Management Center. We have also Reverend Christy, who is the coordinator of Sri Kandi Lintas Iman. And we have Nancy Mitchell from WE Empower Consultant at UN Women. She is based in Toronto, which means it's, I think, 9 a.m. In the morning over there. And we also have my good friend, a very talented woman, and I think one of the best comedians also in Indonesia, Sakdiah Ma'ruf.
Hello, everyone.
Indonesia stand-up comic. She's also a woman activist and one of BBC 100 inspirational women, and especially one of the most charming women I have ever met. So I'm really glad to have you. And tonight's discussion is really to focus on what COVID-19 has meant, has impacted women, and anecdotal evidence suggests that women are more impacted in a negative way compared to men in a variety of ways. Yeah, this includes, for example, domestic violence issues and other issues, and this is why it is important to discuss the role of religious leaders and organizations, and also women religious leaders in protecting and empowering women in society during the COVID-19. I should say that I am from the Minang ethnic group, and Minang is a matriarchal society, one of the very few matriarchal society in Indonesia and in Asia. And because of it, the women rule our society. So in our custom, for those who don't know it, is the woman who propose to the men and give them dowries, and the man would take on the name of the wives, yeah, that he marries, and so on and so on. If they ever get divorced, it's the man who has to leave the house, because it's the woman who control the household, right? So I come from a very strongly matriarchal tradition, and it's also one of the most democratic societies in Indonesia, right? Which proves that when women rule, things tend to be more fair, more wise, and more democratic. I think anthropologists will know how to explain that. But I'm glad we have such a good lineup of speakers covering a very important topic. one that does not get addressed very often. And I want to thank everybody for joining us tonight, and I look forward to a very good discussions and also hopefully enlightening and entertaining. So with that, I want to say thank you and give the floor to Sadia Marufia. Thank you very much, everybody.
Thank you. Thank you very much, Dr. Dino Patijalal. Thank you very much for this opportunity. If it hasn't been mentioned, this discussion is brought to you by FPCI and 1000 Abrahamic Circles project. It is an amazing initiative by FPCI Indonesia. It is an initiative of encounter and experience among people of faith, among people of different faiths. If you have been following FPCIs, there have been an amazing stories of how 1000 Abrahamic Circles facilitate encounter and experience. And unfortunately, due to this pandemic, we can only do the experience part online, doing public discussions, and we're very much looking forward upon the end, hopefully, of this pandemic, the encounter part of the 1000 Abrahamic Circles project. Ladies and gentlemen, every one of you watching from home, allow me to introduce myself once again. My name is Sakdia Maruf, and tonight we are going to have a very important discussion. The title of the discussion is "Keep Her in Your Prayers." We have been receiving grievances from many civil societies organizations, people who have specific concerns on women, on how this pandemic in many parts of the world, including in Indonesia, are not including or are not engaging the experience of women, the perspective of women, in how the government or other authorities handle this pandemic. Ladies and gentlemen, tonight, we are very fortunate. Against all odds, we have all female panel to discuss the importance of religion and religious-based organizations in protecting and empowering women during this pandemic. Pandemic COVID-19 for some is a statistic. I mean, every day we are watching the news, looking at the new numbers of cases unfold. In the case of Indonesia, we are also looking at the outfit of the day of Pa Ahmad Yuryanto, which can also be very interesting. He has an amazing collections of batik. I'm rambling right now. Yes, pandemic also for some is an economic crisis, a social crisis, and in other contexts also a political crisis. However, for many, for you, for me, for all of us, this pandemic really is a story, and especially for women, story of single moms losing their jobs, stories of women-led SMEs that are doing fine until they have to transfer their business online, and then they're losing in the trap of what technology to use. This pandemic is also a story about victims, women victims of domestic violence, were trapped at home with their abusive partners, not being able to access services. Also, for regular women workers, artists like myself, this pandemic is really a story of how women need to convince their children, and not to mention their husband, that they too are working from home instead of just happened to, like, thanks to the pandemic, moms is staying at home for good to serve their family. Not the story, but that is what's really happening. And it exposed the gap, the major gap that we still have in addressing the problem of inequality. This pandemic witnessed loss of productivity, a big loss of productivity among women, especially just because they do not have the right support in place for them. And it has been really problems exist in many fronts and many walks of life. Ladies and gentlemen, everyone watching tonight from home, religion, especially, or should I say, unfortunately, is exposed by the media in terms of how, for instance, how to perform ritual during COVID. Many of the news in the media, especially in the media in Indonesia, talk to religious leader, expose religious leader, and ask questions about how we should perform Friday prayers. Should we open the church, the mosque? Should we, things that are related to rituals, and that is important, of course. But highlights of too much highlights of those issues really blurred the many efforts, mostly led by women of faith, in transforming the society during this pandemic, in helping women go through the pandemic, and helping them recovering their economy, doing work from home, supporting their spiritual well-being, help with the cases of domestic violence, etc. And tonight we are very, very fortunate, as mentioned by Dr. Dino Patijalal earlier. We have our amazing female panelist that will discuss this issue. Allow me to introduce you to Ibu Livia Iskandar. She is a vice chairwoman of Indonesian Agency for Victims and Witness Protection, LPSK. Hello, Ibu. And
Hello, hi.
hello, hi.
Good evening, all.
Good evening. And we have Ibu Rahmawati Hussein, Vice Chairwoman of Muhammadiyah Disaster Management Center. Good evening, Ibu.
Good evening, everyone.
Hello. And
Hello.
we have Reverend Christy. She is the coordinator of Sri Kandi Lintas Iman. Welcome, Reverend Christy. Good evening.
Good evening, everyone. Thank you.
And we have all the way from Canada, Ibu Nancy Mitchell. She's a We Empower consultant at UN Women. It's good morning to you, Ibu Nancy.
Thank you so much for having me.
Hello. Yes, Ibu, our panelist. I think we all agree that women, especially women at the grassroots, exchange knowledge and share their grievances. Also, very importantly, empower each other through sharing stories. And if you'll allow me to, I will start by asking all panelists to just share a story of women that you have been working with in relation to how they do during this pandemic. Before I go to each of you for your individual presentations, please be quick, because this is just a general question to start the discussion. And now I would like to hand the floor to Ibu Livia. Do you have a story of women that you're working with that you can share?
Yes. Okay. I will share two short stories. In terms of staying home, I'm afraid I have not been staying home too much, because with our agency, with the Indonesian Victim Witness Protection Agency, we actually are still working, and the court systems are still working. And for example, the district attorneys, the attorneys, they Attorney General office, they want the victims to come to court. So it's the the perpetrators are video conferenced from prison. I mean, yeah, from the prison. And with us, we have to actually accompany our victims and witnesses through the court process. And so in terms of COVID-19, for example, not so long ago, we actually had to go to court because of a case, a child sexual abuse, a child sexual violence case that actually happened during school hours in a classroom, perpetrated by the teacher. So, and as a you kind of sit there and think, really, during school hours in a classroom by a teacher. So and this had to happen, the court had to happen during COVID-19. So we had to take all the precautionary measures in, all the social physical distancing, and also kind of working to support our victim. Another short story I want to share is about a domestic violence, an intimate partner violence survivor who had to be rescued from her home outside of Jakarta. So we had to dispatch a quick response unit to pick her up, actually in Yogyakarta. But with now we have the official letters and all that, our team was able to pick her up. And just a little bit about our agency, because we're for victims and witnesses who are interested to take their cases to court through the criminal justice system. So we're actually not like a first responder, but in terms of life-threatening cases like this woman in Jogja, and she was like really threatened by her own husband, and so that she would not continue her case, we had to dispatch this quick response unit. But that's like very quickly.
Wow.
Two stories. And also that, one little story.
Yeah.
A lot of the things about sexual violence also perpetrated by family members. We've seen an increase of that, not only during COVID-19, but like the cases, like incest cases. And so I can imagine that the children will have difficulties, living with their fathers or their stepfathers or biological fathers or uncles, whatever, living in the same house as the perpetrators. Thank you.
Oh, wow. Amazing. Unbelievable. I'm lost for words. We say, all of us, most of us agree that home is the safest place during this pandemic, but not for women and children, victims of violence. The last place that they want to stay in, even during such a pandemic, is home, because that's where their abusers are. I cannot imagine. This is unbelievable. We're going to Ibu Rahmawati Hussein. Ibu, would you like to tell a story of one woman, two women that you're working with, a real life story of women that you're working with in the field?
Okay, I have two stories. Because I'm joining with the Muhammadiyah Disaster Management Center. Muhammadiyah is a non-profit organization, so it's working a volunteer. So everyone has their professional job. Many women have to struggle working professionally and working a non-profit. So the women have like many burden. They have to work at home as a way, especially during COVID, because all domestic work usually have to be done by the female instead of male in many tradition in Indonesia. So besides working domestically, they have to teach, they have to also to do the social activities. I will share the story of what we do in Asia, the beginning of Muhammadiyah. Last 2 weeks, we have the national movement of helping neighbor. So we managed to distribute 40,000 basic supplies to the neighbor. So this is the movement that we have. So because during the COVID, it's very difficult, to even buy things in the closest store or market. So it's not easy as a woman to handle all the domestic job without having income, and then or less income, or even they do not know. So that's very important to have the movement of helping neighbors. So we do it throughout Indonesia because Muhammadiyah have the the volunteer all over Indonesia.
Wow, amazing. Yes, amazing, Ibu Rahmawati. I can totally relate. I have a 2 years old, and when asked what you have been busy doing during this pandemic is handling work with a 2 years old and washing dishes. Yeah. And this is amazing. Aishia, usually when we work outside, we only have like morning coffee at our sink, and now we have everything from inside our china cabinet. And yes,
teaching, cleaning, handling kid, handling father,
absolutely, handling husband, absolutely. And another highlight, Aishia Women's Wing of Muhammadiyah National Movement of Helping Neighbor. Amazing initiatives. Perhaps you can tell more during your presentation. And now we go to Reverend Christy. Do you have, I'm sure, as a religious leader, you have a lot of stories from your congregation. Can you share a little bit with us, real life story of women that you have been working with?
Thank you, Mbak Sadia. Yes, maybe the first story similar with what Ibu Rahmawati tell us about the struggle of women who works in home while she must be professional, but also must take care of the children and sometimes her husband. And it is very struggling because especially very little children not know that the mother in home is also work. But yeah, it's very struggling for us. And it's also happened to the member of Sri Kandi Lintas Iman, also the member of the congregation in where I serve. And other struggle is about economy, of course, because we some of the people, or many people, lost their job, or at least if not lost everything, but they less income, and they must manage many things, daily routines, and maybe sometimes it's higher than before pandemic, because the entire day they are at home. The children needs more food supply maybe, and also the increase of the needs to buy internet quota for the children who study at home. Right. And it also affect the students from outside Jogja. I'm in Jogja. Some students cannot go home, but they stay in Jogja, and the parents cannot send enough money anymore because they also impacted in their hometown. But in the midst of this crisis, I know I see many solidarity among the people, including the woman. Some, if even the what maybe we see that she is very less income, very what we call sederhana. It's they want to help others. It's the spirit, the positive spirit in the pandemic.
Amazing.
I think that's Mbak Saidia.
Yes, indeed. We see everywhere across the world, and especially initiated by women, hope and kindness really are more contagious than the virus. And we're very happy for that. And finally, we have Ibu Nancy. Do you mind sharing a little bit of real life stories of women that you have been working with?
Sure. I mean, there's so much to say, and I'm happy to touch more during my presentation. But I think in general, what we're seeing, and it really relates to what my fellow panelists have said, is that this pandemic has placed like a real emotional strain on women, as women are unsure whether or not they're going to be economically, stable or sustained now and well into the future. They're unsure of how to manage double duties related to domestic duties and also working from home. That places a real emotional and stressful toll. And then also women who are experiencing unsafe situations in the home, also related to domestic violence. And so I think that these were issues that women experienced prior to COVID, but that have been exacerbated and compounded with the pandemic. And like I said, happy to go deeper during my presentation, but just want to echo what the fellow panelists have said.
Yeah. Thank you very much, Ibu Nancy. And indeed, the highlight from Ibu Nancy is that what we are hearing and seeing during this pandemic has been happening for a very long time, long before the pandemic. And this is also part of our effort in reducing the gaps in gender inequalities and to continue working to that direction. And ladies and gentlemen, audience watching from home, this evening in Indonesia and also many of FPCI 1000 Abrahamic Circles supporters all around the world, we will start this presentation or the session with Ibu Livia Iskandar. Ibu, you have 12 to maximum 10 minutes, 12 to maximum 15 minutes for your presentations to share the role of also your agency and the role of women in the escalating domestic violence during COVID.
Yes, thank you, Sadia. So I would like to ask the organizers to put my PowerPoint up. Yes, so as I said before, that our agency is, we work with different kinds of crimes, but inclusive of sexual violence and trafficking, as well as domestic violence. And we have seen the rise of that during the COVID. Next, I want to say that I am one of two women vice chairs. We have seven elected by the parliament to hold this public official job for 5 years. So we started 2019 until 2024. And so our agency, we work to ensure that witnesses and victims of crimes can testify in the criminal justice system without feeling threatened and so safely and comfortably. So we do provide protection as well as assistance, and we're under the laws that govern us was established in 2006 and was revised in 2014. And you also can see that some of our priority cases, from gross human rights violation to terrorism, corruption, we protect also whistleblowers of corruption cases, money laundering as well, torture, so not only against women and children. And a lot of times I think people don't really know our agency, because we actually work under the radar, because we hide people, we hide people so that they can be safe, because usually they would actually face a lot of threats by perpetrators, so that they will pull the cases out. So that's why we provide physical protection. Next. So we do provide different kinds. Next, maybe I want to talk about the different kinds of services. So from physical protection to also kind of like ensuring that the victims or witnesses understand, get the information they need. Also and also if they do need a medical assistance with a lot of domestic violence. For example, we had a case, and this is not during the COVID, but we've had cases, really bad cases, in which husbands cut off a husband cut off his wife's 2 legs. This happened in Bali, for example. Another husband cut off his wife's 2 hands in East Nusa Tenggara. And, some of this actually only for reasons, like really trivial reasons, like because they wouldn't let their husband know the password to their Facebook. Or the husband is very jealous because the wife, works outside of the home. She's also, the major breadwinner because the husband doesn't work, and then also gets treated like that. So a lot of times we work with these kind of very severe cases. Like in another case I had to work with in Bali, I came one day before she died. She was stabbed by her husband. It went through her lungs. And so, it's these kind of really terrible, life-threatening cases we have to work with. We also provide psychosocial assistance, but not on our own. We work with different organizations, and we also work with religious organizations. And I wanted to say also, unfortunately, the last few months, even before COVID and now in COVID, during this COVID months, we have seen a lot of sexual violence perpetrated by religious leaders, I'm sad to say. That happens in boarding schools and religious boarding schools. And usually the victim is not only one. We're actually protecting one who was ready to speak up, but the case had to be suspended because of the COVID. But she is actually one of 20 victims, and only 1% was. So, we work with religious organizations because, unfortunately, some of the perpetrators are the teachers or the owners of the boarding schools. So, we make sure, for example, that the victims or witnesses is protected physically. They also get information on when the court case is, and they will be supported by our agency's personnel every step of the way, so they would feel very comfortable when testifying. Next. And well, we know that this is a global phenomenon. 1 in 3 women experience physical or sexual abuse. And so next, and especially in terms of COVID, we've seen a lot of, like, for example, other organizations. I think with our agency, because we only work with a smaller percentage of people who want to take their cases through the criminal justice system, people don't report firsthand to us, but they report to different, they report to the police, they report to legal aid foundations, they report to the head of the Women Empowerment and Child Protection, for example. And I'm quoting here from the Jogja case. So we actually, because we're only the only one right now in Jakarta, but we will actually establishing our representative offices in Medan and in Jogja later this year. So the Jogja folks, Bu Rahma and Pendeta Christy, I will be in touch with you in terms of that, because we do get referrals. We under the law, we're only kind of like we work with a level of threat, with the threat level when it's like life threatening and all that, and also that they have to report this to the police. And a lot of cases, as we know, they do not want to report to the police because of several reasons. Like so the agency LPSK, we've seen 20 sexual abuse cases in March, April during the COVID, and 3 people domestic violence case during the COVID. And so you can see that there's a lot of work that we have to kind of socialize victims and witness rights, because people don't understand about restitution, for example, that you're actually entitled to have damages paid to you by the perpetrator and her family, for example. But that actually has to go through procedures. For example, we have to and it's our agency who is tasked to kind of assess what kind of mental health harms, how many times to go to psychologists, how many, how much they spend on medical expenses. That's not covered by us. But if it's under our protection, we will, we actually are a state institution covering all of this. Yeah, next. So this is active cases of gender-based violence to women and children that we are working with right now. Total of 213 cases per April 2020, the whole of Indonesia. And during the mobility restrictions, we have been able to work with third parties, whether it's the women empowerment, child protection agencies, or we work with legal aid foundations. We also work with service providers, women's crisis centers in specific places, especially I think in remote areas, because some of the cases that we're dealing with, unfortunately, not only perpetrated by religious leaders, but are perpetrated by public officials. Wow. So the risk is very high, and that's why we have to kind of keep a low profile in terms of that, because we don't want to tell people, we don't want to tell the public, this case, we're protecting this case and all that, because that will definitely endanger their lives. Okay, next. So what we've done so far, we've dispatched a quick response unit, as I mentioned in the beginning, to protect the intimate partner violence case out of Jakarta because of escalated threat. And we've worked with, with the police headquarters, with Attorney General's office, Supreme Court, for example, because we write a lot of letters to highlight cases, for example, that have not gone forward for whatever reason. And especially when it's religious leaders or public officials, we see cases kind of like come to a halt. So we try to push these cases. We try to work with our Minister of Women Empowerment and Child Protection, with Ibu Bintang, for example, to tell her, we need your help to get these cases along. And also, next, we have worked with different kinds of religious organizations. For example, With sexual violence in East Nusa Tenggara, for example, we've worked with Catholic nuns and fathers in providing protection. We've also worked with religious boarding schools in Central Java because some of the cases actually happened there. So to the perpetrator is one of the teachers, for example, and unfortunately someone with very high level connections. So so we need to kind of work kind of like design advocacy in terms of that. Also trafficking in Batam, for example, we want to highlight the work of Father Pascalis, who worked with us against human trafficking with some of the cases of human trafficking. Next, so some of the barriers, the challenges in providing protection, I guess we need to ensure that interagency collaboration is needed for law enforcement to be upheld. And as I mentioned quite a few times, that sexual violence can also be perpetrated by religious figures such as teachers and owners of boarding schools and other community leaders. That's harder for victims to report. And a lot of times, you know, that it's, you know, her word against theirs and all that. Yeah. And so it's some of that. So lockdown in areas, yes.
Very sorry to interrupt. Do you mind wrapping up?
Wrapping up, yes, I will.
1 minute or so.
Okay. Yeah. All right. So next slide, please. This is actually my last slide. I just want to say that recommendations for religious organizations, we need an internal regulation within religious organizations or in boarding schools or in, you know, like how to manage sexual violence, prevent and manage. And we've seen also religious organizations provide shelters for women and children, especially IPV, intimate partner violence or domestic violence, who have nowhere to go. And we need education for children attending religious boarding schools about sexual reproductive health and social assistance. We talked about how economic hardships is experienced, especially with women who's not the breadwinner. And some of these domestic violence cases, for example, are those wives who are not the breadwinners. So we need policy in place, and also maybe we need the police to do more outreach services if there's a call. We do have like a hotline. I think the police has a hotline, but I don't know whether every you know, every urgent call would actually be outreach. So thank you for listening, and I'm sorry to also highlight the fact that religious leaders can be perpetrators as well, as we have seen quite a few cases.
Yeah, as we have seen. Thank you very much, Ibu Livia from LPSK. Several highlights from Ibu Livia's presentations that during this pandemic, we have also cases previous or before the pandemics, and we need to focus on the protections of victims of violence when their cases are suspended because of the pandemic, and then new cases during pandemic, and also the need of policy in place and collaborations from all stakeholders, especially highlighting also in the role of religious institutions. They are the one who are working very close to their congregations and can do more in protecting women in collaborations with agencies like LPSK. And speaking of the role of religious organizations, our next speaker, we have Ibu Rahmawati from Muhammadiyah Disaster Management Center. Ibu Rahmawati will be able to share more about the role of religious organizations and how women are involved, and also how the policy of MDMC ensure inclusivity and engagement of women. And perhaps Ibu Rahmawati can also share more about that very interesting Aisyah initiatives on helping neighbors, and probably can also link that helping neighbors initiative to protecting women victims of intimate partner violence or domestic violence living in the neighborhood. The floor is yours, Ibu Rahmawati.
Thank you, Ibu. I tried to share my screen for those of you who doesn't know the Muhammadiyah. Let me see. Can you see it or not? Because I have double screen. Let me just go there. Oh, not this one. Just a second. Let me share the screen. Where is that? For those of you who know Muhammadiyah, Muhammadiyah is one of the largest. Why it doesn't appear? I usually do that. Sorry for the technical. I just go ahead. For those of you who doesn't know Muhammadiyah, Muhammadiyah is one of the largest Muslim organization in Indonesia. The member is estimated 40 millions, and Muhammadiyah has the woman wing organization called and other 7. I'm just curious. I usually use for the school I'm teaching, and why it doesn't work, the sharing one. Okay, let me share. Okay, can you see it now? I'm sharing the screen. Can you see it? No?
Not yet, Ibu.
Not yet. Okay.
Not yet. Not yet.
I don't know what happened. I usually teaching and I'm able to do it. So tonight, or yeah, it's kind of weird. Okay. The Muhammadiyah have the board in 34 provinces and also in 471 districts in Indonesia, and half of Muhammadiyah are women. So women play an important role, and as you mentioned or been mentioned by Dino, they very important of or the why FBO and religious leaders are critical. First, the religious leaders are equipped with the courage and vision, who play unique role in bringing people together. And then the second, let me see. I'm just curious why it doesn't work. And the religious leaders also could able to empower the woman through all different activities. And as we see that many women affected more during the COVID because of the women have more like double duty or having subordinate in the term of domestic or even in the public space. So women have difficulties in handling the situation more than men. For example, like in Muhammadiyah, we have 18,000 schools throughout Indonesia. And many of them are paid by the non-profit organization. So the salary is not supported by the government. During the COVID, then they lost their the profit. So many female teacher, then they are not afforded to get the income, and then they have to struggle more at home. And then the second, Muhammadiyah have 473 hospital and clinics. 70% of healthcare facilities are women. And during the pandemic, they are the most threatened because the lack of the PPE, the personal protection equipment. In Indonesia, as you know, it's very difficult to get the PPE, or PPE is also expensive. It's not only coverall, gloves, and everything. And many women work, or the health sector is also affected. So Muhammadiyah already lost 3 nurses because of COVID. So it's really yeah, it's really bad because most of the nurses are women or female in Indonesia, and 70% of healthcare facilities are women. So they are the most vulnerable in terms of dealing with the COVID. So they cannot go back home because they have to serve, and the healthcare facilities is overwhelmed. Although Muhammadiyah Hospital or Aisyah Hospital is not the referral hospital, but they cannot reject any patients, and it's become more and more patient coming into the Muhammadiyah and Aisyah Hospital, and it's really difficult to get the access on PPE. So the health become an issue. And then the third one is the women activists. They used to go out to help to empower women, and they cannot get to go because of the stay-at-home or restriction to go out. The issue is the lack access of women or in an IT. Many women, especially in our organization, they are not used to have or to use the IT. So it's not easy to get the access to to resources, to get the information, to better educational module. It's also become difficult for women. And many, when we call for the meeting, Zooming, it's very interesting that the ibu-ibu, the female leaders of Aisyah, they always ask their kid, their grandchildren to start by having how to use this. So it's very interesting discussion how they have to learn to be able to contribute to the society beside at home. So, but they are still eager to do so. So that's why through the Zooming, we managed to call for the movement on helping the neighbor. Helping the neighbor is how we collected the basic supplies. We call it sembako. It's basic supplies, consists of like rice, sugar, oil, and then also vegetables. Yeah, we also provide them with all the basic supplies to almost 49,000. Yeah, nationally. And we still continuing try to helping the neighbor, because not everyone got lucky to get the salary or income, because in Indonesia they many of them, especially the low income people, they only get like 1 day payment or salary. So it's not easy to get the income during the COVID. And then the economic issue push also women to go out, because, and this is become even more vulnerable, because if they do not get any additional income, they will get another economic issue. Women get more and more problem in during the COVID. So what we do, we try to work with other organization as well. We work with our own philanthropic organization called Lazismu, Lembaga Zakat Infak is a philanthropic organization to fundraise, to provide the small fund for the teacher, and then for the woman small scale business, so they can still run the business to make, for example, to make the mask for all the clinic of Muhammadiyah, or even for all the general purpose. And then we train them to make the overall or the PPE, the protection clothes, the overall. And we also working with the people with disability to make all the PPE are needed for all the clinics. So we try to encourage them to work through the network of Muhammadiyah, how we raise internally within Muhammadiyah, and then we also collaborated with other international agency and donors. So that's what we do. And currently, we are working in 34 provinces and almost 400 districts in Indonesia. We are working Muhammadiyah and Aisyah side by side. The woman and the woman wing of Muhammadiyah is working side by side, and we currently already can collect it almost 155 billion rupiahs. I do not know in US dollar. 154 billion is around, if it's 1 billion, 15 billion is 1 million US dollar. So 15 million US dollar. We already distribute for all different purposes, for PPE, for helping the Pulsa, the prepaid card, yeah, or for the quota for the internet, and then for the food, basic supplies, for disinfectants to keep them healthy, and then for different purposes, including helping students who are staying in Jogja or in my hometown, because they cannot go back, like what Reverend Christy mentioned. There are many students studying in Jogja. Jogja is university town, so we also help them to provide foods, to provide basic supplies they are needed. And we also helping the other small scale business by trying to have transfer program and MPCA, multi-purpose cash advance, for their capital to increase. I'm sorry, I do not know what happened. I usually can share because I'm teaching every day, almost every other day, but I don't know what happened today. I cannot share the screen, but that's the story. Hopefully it explain more, and then we can have the more question and answer.
Yes, thank you so much, Ibu Rahmawati. That's perfect. It's even better than the slides, perhaps. But also, our biggest condolences to Muhammadiyah, to the big family of Muhammadiyah. As Ibu Rahmawati mentioned, Muhammadiyah has lost 3 nurses, and as we know, all across Indonesia, all across the world, healthcare professionals, doctors, nurses, those who are working at hospital and those who are working at healthcares are at most risk, and we have lost many of our medical workers, and our biggest condolences for our medical workers. Ibu Rahmawati highlights a very important issues of women struggling at all walks of life. Women at home, they're struggling with double burdens, triple burdens. Women who are first responders, nurses, doctors, they lost connections with their family because they have to stay at the hospital, and they're also at risk. And most nurses are women. Of course, lack of PPE. Women activists, as mentioned, we're going to discuss more during discussions about technology literacy, but it is challenging that when we have victims of domestic violence, for instance, at home, and then they can only be reached through technology, but the social workers, many of the activists, are also struggling on how to master technology, and that is a big gap right there. Beautiful discussions, and congratulations, Muhammadiyah, for the 15 million US dollars, and it's amazing. I'm sure that it also happens with other religious organizations. Next, we are very fortunate to have Reverend Christy She is the coordinator of Sri Kandi Lintas Iman, a very important interfaith initiatives based in Jogja. Reverend Christy will share more about Sri Kandi and about the work that Sri Kandi has done and how religious leader, women religious leader, women of faith, most importantly, can help women during this pandemic. Please welcome Reverend Christy.
Thank you, Mbak Sadia. Good evening, everybody. It's very good to have this opportunity to share about Sri Kandi Lintas Iman, an interfaith organization, and it's only it's women interfaith organization. I will share screen. Okay, well, it's sharing. Okay, my name is Christy. I am a pastor in a Reformed church in Yogyakarta. It's named Gereja Kristen Jawa or Christian Church of Java, Gondokusuman. And now, started this year, I am coordinator of Sri Kandi Lintas Iman. I was ordained in GKJ Gondokusuman in December 2008, and at that time the church was 95 years old and she is an open church. Until now, even the church stated that we are open church. So the church usually opens to students or anyone who want to learn about Christianity, and also open to any interfaith dialogue. She also opens to do cooperation with ethnic organizations, including other religious organizations. So since the beginning, the church led me and other pastors. We have 6 pastors, 3 of us are women. The church led us to participate in any social, even interfaith organization and activities. First, I involved in Young Men's Christian Association until now, also in Young Women's Christian Association until now, and also the church gives me permit to attend study intensive tentang Islam, intensive study of Islam, and also School of Peace. And these experiences lead me to understand better about religious diversity. The experience with Sri Kandi Lintas Iman started at August 2015 when a workshop held by Wiwin Siti Aminah. She is an awardee of KAI-CEID International Fellows Program in cooperation with Pengurus Wilayah Fatayat and UDIY. At the time, we have workshop about revitalization women's role in managing religious diversity in Yogyakarta. For 2 days, we learn about other religion, we talk about our prejudice about other religions and got clarification about it. We also learned how to cooperate in the context of diversity. And at the end of the workshop, the participants agreed to form an interfaith community to get better understanding about other religions. The name chosen for the community was Sri Kandi Lintas Iman. We usually abbreviated it as Srili. Sri Kandi is a woman figure in Javanese leather puppet, not she is a wife and also a prajurit, a knight. And while Lintas Iman means interfaith, so we choose the name Sri Kandi Lintas Iman. The Srili declared as women interfaith community to do dialogue and care of social problem, especially women and children. Why women? Because we aware that there was no enough programs on interfaith issue initiated by civil society in Yogyakarta that invites young women from different religious backgrounds to sit together and share their experiences in order to learn together on how to manage religious diversity. whereas in fact, women play a very important role in creating harmony, security, and peaceful coexistence in the society. And then the vision of the Sri Kandi Lintas Iman, you can read in the screen, the realization of women's interfaith community actively taking part in conducting interfaith dialogue and building cooperation in responding to the issues of women and children. And the mission, one, strengthening the bond of sisterhood among members of Sri Kandi Lintas Iman. Second, establishing and improving the capacity of the members and the community for interfaith dialogue and cooperation. Third, developing and strengthening interfaith network. And fourth, responding to social issues, in particular, the issues of women and children through interfaith-based activities. So as I said, it's women only. Because women are often left behind in the interfaith issue and related with that in peace building process. We have 5 core values: solidarity, dialogue, cross-identity, empathy, and empower. And to achieve the vision, the mission, and to live the 5 core values, if I make short, we have 2 concerns to do this. The first is the knowledge, and the second is about relation. The concern of knowledge, I means really is to let the member have better understanding about various religions and beliefs. So we do it by visiting various religion worship places. This is the first programs really do in 2015 and 2016. So the members can experience the feeling, enter other religions worship places, and get first-hand information about the religion. It's very interesting to listen from them about their experience, about their fear to enter other religious places. But after that, they can feel the hospitality from every religion and belief. It is continued by interfaith pilgrimage, or we call Ziarah Lintas Iman, and also by do matriculation for new members or other activities. We choose the places in religious places. So sometimes we do syawalan in church. Other times we do buka bersama, breaking fasting in the vihara, so we can feel the atmosphere of the interfaith, and also we can learn about other religion. The second concern is about relation, and about this concern we do it in daily life. It is done through 2 ways. The first is programs about interfaith, and then the working together. There are programs that let the members and sometimes public know about interfaith. So not only visit the places, but also we learn how we can live in interfaith or in religious diversity, and also related with actual issues, especially women and children. We do workshops about conflict resolution, how we as women can participate in conflict resolution. Then we also have public discussion about gender, workshop about early childhood education in the condition of diversity. Also, we have a seminar on peaceful election, and many others discussion. So we learn about the relation, how we can relate in daily lives. And every programs, of course, we need organizing committee. Now, in this organizing committee, the members work together, and in the work together, through the work together, the members learn to know and respect each other. For example, non-Muslim members learn to understand that there are specific times for Muslims to pray, so they must stop the meeting for a while. Sometimes when we do programs in the Ramadan month, the Muslim members respect the non-Muslim when they need to lunch, although they must fasting. So we can know that we have, we each of the religion, we have our own identity, our own daily life, and also we usually through media and networking team, we usually make an e-poster of religious celebration, including celebration that not make holiday in Indonesia, so the members know other religions holidays. Through the simple activities while work together, members are used to live and respect other religions. Other empowerment works in Srili is to let members choose which team they want to involve. There are 5 teams: empowerment, research, media and networking, advocacy, and fundraising. Each team has its program that let members actualize themselves according to their interest and ability. Now come to the pandemic condition and the impact of pandemic and Srili's action. The first impact that we learn from the members is economically, that some of the members lost their income or they get less income than before. So we ask if they need the help, and we do the help basic need package. We do it. We already did it in 30 April and 22 May, and we will do the third package in 25 June.
Reverend,
yes.
Reverend, sorry to interrupt. Do you mind wrapping up in 1 minute or so?
Okay, and the other program for economy is online market, and we start this week for the 2 other programs: psychological and mental support, and also cultural and spiritual support. It will start this week. And of course, we do this all in networking with our partners, and also the donation from the member itself, not because we have capital in money, but we have networking. And about the government, we see that government needs to make consistent policies, use gender perspective and gender mainstreaming. So we do these programs, economic, psychological, spirituality, because we see that government not do gender perspective and gender mainstreaming in the policies. And we as civil society need to fill the gap. So about the other program, you can follow our social media. Please like, please follow, and you can get information about, especially for the program in the COVID-19. Thank you, Mbak Sadia.
Yeah. Thank you very much, Reverend Christy. Beautiful presentation, ending with a highlight that government doesn't give enough emphasis and mainstreaming gender perspective in how they respond to a pandemic, and civil society organizations, including faith-based organizations, interfaith-based organizations, are there to also fill the gap. And I think interfaith initiative is more important than ever in this time of COVID-19, not only to provide relief, solidarity, and recovery, but also to battle against the many racial and religious biased messages about the pandemic circulating in many WhatsApp groups, messages, and social media. So dialogue, how to cooperate in the context of diversity, as mentioned by Reverend Christy, more important than ever. Last but not least, we will have a perspective from We Empower, and we are very fortunate to have Ibu Nancy Mitchell with us, Hello, Ibu Nancy.
Hi, let me just share my screen. Okay, are you able to see the presentation?
Yes.
Yes, okay.
Please welcome Ibu Nancy Mitchell.
Great, thank you so much for having me. So as mentioned, I'm Nancy Mitchell. I'm currently located in Toronto, Canada, and I work for UN Women on their We Empower program. So I'll just briefly introduce the organization and the program. So UN Women is the UN entity working towards gender equality and women's empowerment. We have offices and presence around the world, including a regional office for Asia and the Pacific that's located in Bangkok, and a country office in Jakarta. So we're really excited about that. And we focus on several pillars, including political leadership, ending violence against women, economic empowerment, and others on the screen. And then I currently support the We Empower program, which is a joint initiative between the UN Women, European Union, and the International Labour Organization. And we focus on responsible business conduct in G7 countries and convene conversations related to gender equality and women's economic empowerment in the workplace, the marketplace, and in our communities. And I do want to highlight that the We Empower program has a kind of sister organization called We Empower Asia that operates in China, India, Indonesia, Malaysia, the Philippines, Thailand, and Vietnam. And our main focus is to disseminate and encourage businesses to sign on to the women's economic principles, women's empowerment principles, which are on the screen right now. Okay, so in the interest of time, I'll go right into the impact of COVID on women's economic empowerment. And there's a few key areas where I think women have faced instability or vulnerabilities related to economic empowerment. And the first being vulnerabilities related to women in the informal economy. So in many economies, the vast majority of women's employment is in the informal economy. And reporting from South Asia finds that over 80% of women in non-agricultural jobs are represented in the informal economy. But often the sector offers few protections against dismissal and few protections related to coverage of paid sick leave, maternity leave, pensions, and access to other adequate social protections. And further within the informal economy, to earn a living, a lot of workers depend on the public space and social interactions of consumers, which has been greatly limited due to social distancing and flattening the curve. So we see kind of economic instability related to participation in the informal economy and uncertainties of how consumer bases can be sustained in this economy. I also want to highlight just job insecurity and precarity in general. Women have lower rates of labor force participation than men and are subject to lower wages and a lack of leadership and representation at higher decision-making levels. And actually, our report from the Regional Office for Asia and the Pacific highlights that compounded economic impacts are felt especially among women and girls who are earning less, saving less, and also holding insecure jobs. We see that global value chains are being disrupted. And if we look at statistics from Myanmar, for example, we see that a lot of women are employed in the garment industry, 80% actually. And so as a result of factories closing, we see that these supply chains are being disrupted and women's jobs are kind of facing like an instability. With non-essential businesses closing, we see that many female business owners and entrepreneurs are experiencing a lack of financial stability and then threats to their livelihood. I also do want to highlight, as some of my fellow panelists have mentioned, that there are vulnerabilities for women as frontline workers. I think it was mentioned already, but globally, women makes up 70% of the health workforce, whether this is nurses, midwives, community health workers, and other healthcare professionals. And they're also overly represented in other frontline service sectors, whether this is like just providing general services, and working in storefronts, et cetera, those that remain open. And so we see that women are extra vulnerable and susceptible to exposure of the virus, but also long working hours that takes both a physical and a mental toll. Then I believe this is fourth, we look at the added work of unpaid domestic work and care work for women. Yeah. So as mentioned, globally, women spend approximately 3 times more time on unpaid domestic and care work than men. But across Asia and the Pacific, this figure can be up to 11 times more work. So that's kind of a staggering difference between the amount of time that men and women spend on domestic and care work in the home. And with school and childcare facility closures, more families are at home. However, women continue to take up the majority of this care work. And this puts both, as I mentioned, a physical and a mental toll on women, as they're taking a lot of the emotional labor and providing a lot of the emotional support for their family members, as well as taking care of domestic work, and then just responsibilities if they're also working in the workforce. So this kind of double day that we've mentioned. And then lastly, I want to highlight a spike in domestic violence and abuse, which has been mentioned previously by other panel members. COVID-related unemployment has increased the number of partners staying at home. And for women in abusive situations, this has led to a spike in domestic violence cases. But it becomes a cycle because I think further economic insecurity and unemployment often traps women in abusive situations. And then it's really difficult and often impossible to escape. So we see links between economic security and increases in domestic violence, and a cyclical process as well. But there's good news. There's things that can be done both at a higher government level, at the level of businesses, and at levels of community networks and the individual. So I want to highlight what can be done for economic empowerment. Currently, UN Women is supporting a lot of women-owned enterprises and engaging the private sector. A really great example is some of our work in South Africa. We've been offering virtual learning courses through online classrooms and partnering with organizations and companies like Google. So we can help women navigate the online structures of applying for government stimulus funding, which I think is a really important thing that we should be looking at. But then just within our own program, that We Empower Project, we've been playing a big role in advocacy and knowledge, and encouraging businesses across the country and across the G7 to sign on to the Empower Principles, because these are things like equal pay, maternity leave, women in leadership positions, which have an impact in the new normal that we're trying to create, and really ensuring that women have stability now and in the future. But there's things that, community networks can do as well. Businesses, for example, can play a role in ensuring that women are included in a company's response and recovery plan from the get-go to make sure that barriers are eliminated at the forefront. Businesses can also promote flexibility and understanding related to women's double workday in terms of domestic work and then their workplace responsibilities. But they can also simultaneously develop policies related to parental leave, equal pay, women in leadership, just to ensure that their businesses are applying a gender lens to all of their work. And then the last thing is that I would encourage partners and families to do that equal take-up of domestic work, because domestic work and care work are critical for sustaining societies, but we often don't recognize it and it goes unnoticed. And so by splitting this kind of physical and mental load, it's a big help towards the goal of gender equality. Then if we're looking at what can be done for eliminating violence against women, UN Women in particular has been monitoring and assessing violence against women. A specific example would be in Cameroon or Senegal, where UN Women is strengthening access to essential and quality services for survivors of violence during the pandemic. We need to make sure that we're really ensuring that these services are still out there and they're still accessible. But it's important to know that individual and community networks and groups are responsible for knowing signs of physical, sexual, emotional, psychological, and economic violence. We all need to be mindful of what these signs look like and where resources are available. And community networks can have a hand in disseminating these resources, whether they're how to safely continue employment, how to access survivor referrals, how to access virtual legal services. It's the responsibility of all of us to know the services that are out there and to provide them. And then Lastly, on the what can be done, I think it's important to ensure women's leadership. And so something that UN Women has been doing is, specifically in Nepal, convening women's leadership. So we've been trying to have women leaders from various sectors, whether this is women's organizations, organizations related to individuals with disabilities, organizations focused on LGBTI organizations, and kind of convening all of these women to have some sort of like sustained and succinct recommendations on what can be done to support women during the pandemic. But on a more, I suppose, community level, policymakers and community level representatives can be collecting sex disaggregated data, both on a macro level, so that would be like a national level, but then also on a community level, because we really need to be identifying the barriers that women are facing, but also data related to virus spread and infection rates and violence against women and economic instability exacerbation, because it's only in determining this kind of data that then you can make steps to eliminate these barriers or these vulnerabilities. So I would encourage the collection of sex disaggregated data. And then, as mentioned, I think it's super important to include women in both the macro and micro level response plans, whether these are national level response plans or whether these are response plans within local community networks. So how your business can bounce back, but including women in this, or how your organization can bounce back, but including women in this. And then finally, I would say that we need to ensure that women have a sustained participation in terms of decision-making in all kinds of networks, whether these be religious organizations, women's organizations, businesses, community organizations, et cetera. If we're gonna be creating some sort of new normal, let's make sure that it's a little bit more equal, well, not a little bit, a lot more equal than the ones that were existing before. And then my last slide just relates to the work of religious leaders in addressing gender inequality. At UN Women, we try to involve the work of local leaders in our work, and this includes involving religious leaders because religion is so fundamental to the lives of many, and it's really important to incorporate the message of gender equality into their work because this can touch the lives of so many, and it's just crucial for us to be working together in general. So I included a quote from Bukubru, who is, a religious leader who has been crucial for the Imams for She, which is kind of a take on the He for She campaign that we have, but it's essentially encouraging Muslim leaders to take up the He for She campaign. And so, yeah, I think it's super important for us to be working together. And that's why I so appreciate this invitation to be here today. And I hope that that was okay and not too much information. I know I talk a little fast, but thank you so much.
Thank you so much. Thank you so much, Nancy. It has been an amazing discussion with many informations from our panelists. Not only information, really call to action. We have not discussed the issue and needs and situations of women enough throughout this pandemic, and we are very happy that tonight is really the night that we can really focus on the issue of women. Having said that, I would like to ask for your kind permission, all the panelists and also those of you watching from home, to steal a little bit more of your time. I know that we're supposed to end this discussion at 9:30 p.m. Jakarta time, but I hope that you will allow us for another 10 to maximum 15 minutes for a quick Q&A. We have a very important discussions from our YouTube live viewers as well. But I would like, now that we have Nancy, I would like to start by sharing one question to Nancy. Nancy, at the last World Economic Forum, Indonesian Foreign Minister Ibu Retno Marsudi emphasized the importance of women-owned businesses and also women-led SMEs in the recovery, in the economic recovery during this pandemic. However, she also emphasized that technology is one of the barriers. Is it really the case? And how has it been addressed internationally?
Yeah, that's a good question. Yeah, I would agree. I do think that technology is a big gendered barrier. I think that we see technology literacy rates are higher in men than they are in women. And I would say that especially now that a lot of the businesses have been shifted to online, it can be difficult for business owners to navigate the process of like shifting all of their work online and then trying to continue business as usual, but online. I would say that something that we've been doing, and particularly in Indonesia, actually, is the development of the We Learn platform, which is a platform for women entrepreneurs and women who aspire to start their own businesses. And the platform kind of provides online skill building and training to assist in this business development, but trying to build up, technological literacy skills. And so this is kind of a mix of technological literacy and business building. So I would encourage anyone in Indonesia to really check out the We Learn platform. But yeah, I definitely agree. I do think that technological literacy is something that is pressing, especially given this time.
Yeah. Quick follow-up. Do you think incentives should be given more to women in terms of, ensuring women are at the center of discussion women are acknowledged as one of the forefronts of economic recovery anyway. So what do you think?
Yeah, absolutely. I do think that we need to be doing more work to include women in our dialogue, but also provide opportunities for women. So I think we can be doing more to increase mentorship for women, sponsorship of women, the development of skills training and abilities training for women. It's important to know that women already have incredible skills and have value to offer and have diverse opinions and things to offer in the workplace and also in society. And so we just need to really tap into that, harness it, and value it. And so, yeah, I would say, increase training for technological literacy, but I would also say just making sure that we afford the same opportunities to women that we do to men. There's no reason why we shouldn't be doing that. So
no reason why we shouldn't be doing that. That's a call to action right there. And we have questions from our viewers, our YouTube live viewers. First is from Arumdria from Kawan Bineka, the name of the organizations. I would like to respectfully invite Ibu Rahmawati and Reverend Christy to address this question. The question is, what is the situation for women in eastern part of Indonesia and other remote places? What kind of protection mechanism are in place? So I believe that Ibu Rahmawati, with the vast network of Muhammadiyah all across Indonesia, can address this question. Also, Reverend Christy, with your interfaith work. We are going to start with Ibu Rahmawati, the situation for women in eastern part of Indonesia and the protection mechanism in place. Hello, do we have Ibu Rahmawati?
I still unmute. I need to unmute. Sorry.
Oh, okay.
Okay. Yeah, it's a good and difficult question. As you know, even before COVID, the eastern part is there is a gap in development between the western part of Indonesia or the mainland and the outer island. So it's very important here the solidarity and empathy from all different area to the other eastern part. What we've been doing actually, we also in Muhammadiyah, we are not differentiate between eastern or western. Whoever needed, we are helping. So what we do is based on using our fast network, we try to ensure that everyone got help, meaning that every board of Muhammadiyah or Aisyah at various level, because Muhammadiyah is like government within government. We have at the national, provincial, district, sub-district to run to branches. So the branches responsible to report. So for example, if there is an cases of the suspected COVID, we call it PDP or ODP, they can report. And then we also open for call. We all have call centers that can be used all over Indonesia. So the call center is open for 24/7. The call center can provide information, can also provide the psychosocial support and service, or even religious issues or matters that they want to ask. So what we do is providing the support system through the call center, so they can use SMS, WhatsApp, or even calling directly. And then we can also get the information if they need it. So we try to help as much as we can through the closest place, because we also distribute the basic supplies even in Papua and in NTT, in Sika, in different area. So we reach out the area, because none of Indonesian places right now is sterile from COVID cases. I think 34 provinces is almost affected, but NTT and Aceh is the less, nonetheless.
Yeah. Yes. All parts of Indonesia are affected, and Muhammadiyah also provide aids, relief, also a call center in many different parts of Indonesia, including eastern part of Indonesia. We're going to go to Reverend Christy to address this question, and also later after Reverend Christy, we are going to go to Ibu Livia. That would like to share the work of LPSK in Papua as well. And now we go to Reverend Christy. How do you see the situation for women in eastern part of Indonesia, if you work there, or if the network of GKJ, of church also, I believe, and most certain, work in mostly in eastern part of Indonesia. Reverend Christy, please.
Okay, thank you, Ms. Sadia. Thank you for the question. We can see that in Java itself, in Jogja itself, there are many problems faced by everyone in this pandemic. I thought I thought about the economic, about the other, and so I can imagine it's may be worse in the remote area, in eastern part of Indonesia, especially in the remote areas. Our church received one letter about the request of help to APD. We call it APD in Indonesia.
PPE, the
PPE,
personal protection.
Okay. Personal protection, yeah. So they need that. Maybe it's the problem that every hospital face, and in a remote area it worse. But in Sri Kandi Lintas Iman and the church where I serve now, the work itself is only in we have limited resources, so we only can work in Jogja, and Sri Kandi Lintas Iman also in Jogja. But when we start to do the psychological, the mental support, the spirituality support, we use the technology, we use the online classes, and we start to publish it. Many people also from other island, from Manado, from every other part of Indonesia, they want to join. So we hope that we can reach other people outside Jogja through this technology. We hope those who can access technology then can share it offline to their fellow their neighbors who cannot access technology, so it can spread to more people. And we hope that we can we in Sri Kandi also, in Srili also have networking in gender mainstreaming. We learn about the other places, what they face, and we hope that it can be help to strengthening their work in their own place. Sorry.
Thank you. Thank you so much, Reverend. Thank you so much. Indeed, technology sometimes poses barriers, especially to women, but most of the time it breaks barriers. And now we are going to go to LPSK, Ibu Livia. How's the situations of women in eastern part of Indonesia and the protection mechanism in place?
Thank you, Sadia. So yes, I would like to just highlight that some of the things that we've done actually is to work with universities in both Papua and West Papua. So we've worked with about maybe about 60 universities across Papua and West Papua in terms of trying to get them to each universities to draft an internal regulation for the prevention and management of sexual violence, because our agency has actually protected students who were who had to suffer sexual violence within the university. So one of the things that we've tried to do is actually work with the higher education body that's part of the Ministry of National Education to so that they are aware of this. And so we've done that. We've started that work. And so hopefully more universities will be attuned to having these draft regulations in place.
Wow.
Thank you.
Yes, hopefully soon. Hopefully soon.
Yeah, it's coming. It's coming. Yes.
I mean, yes. And now for final question before we close tonight's amazing discussion, I think I would like to ask Nancy to address this question. The question is from Agnes Lailika from Srikandi Lintas Iman. The question is something that we are discussing lately. So, Nancy, what do you think? What is the most essential thing to prepare, especially for women and community who want to get back to workplace and starting the so-called new normal? Women have been worried about their own well-being, about their children well-being in this new normal, and many women are in, as you mentioned, Nancy, in informal sectors, and during this so-called new normal, they may not be as protected. What do you think? What women and society, also policymakers, should do?
Yeah, that's a really good question. I would say in terms of society and policymakers and business owners, I would really encourage those who operate in the informal economy to extend the same social protections that are afforded to those in the formal economy. I really think that we need to be critically looking at the protections that are lacking in the informal economy. So business owners in the informal economy, but also policymakers should be extending protections, whether this is maternity leave, equal pay, family-friendly policies, policies related to sick leave and dismissal. And I think a really big one is also paid leave. So making sure that anytime a woman has to leave the workplace, whether she's ill or whether she's caring for a family member or whether she's just had a baby or just adopted a baby, that this leave is paid, because this is a real source of stability for a lot of women. And then looking at the flip side, the formal economy has a lot of protections, but these aren't necessarily adequate or up to ILO standards. And so I think just an overall reevaluation of all of our policies in the private sector moving forward, and making sure that we're incorporating women's voices at the forefront of developing these kind of protections and then implementing them on a wide scale. And this also goes for women business owners too. I think that women business owners need to take this into account as well. That would be my suggestion. Hopefully that answers your question.
Oh, well, thank you so much. And we are wrapping up our discussion now. And I would like, now that we have Nancy with us, one final quick message, Nancy, to close this discussion.
Ooh, That's difficult. I mean, something that I didn't talk too much about in my presentation, but I think is super important to quickly highlight is that, and I think it's been mentioned by other panelists, is that we really need to be addressing some of the gender stereotypes and the gender norms that we live under within our societies and within our communities, because these really inform the actions that we take. And so we need to be critically addressing, the things that we see are women's abilities, our perceptions of women's abilities, our perceptions of the rights that we think should be afforded to women, and our perceptions of the opportunities we think should be afforded to women, really critically evaluating these on a higher level, on a community level, and on an individual level, and then making sure that everything that we do, all of our work, is informed by messages of inclusivity and diversity. So that's what I would say.
Wow. Thank you so much. Very, very strong message for us to wrap up this discussion and hopefully continue with more similar discussions next. And Reverend Christy, your one final quick message.
Okay, thank you. Thank you for the opportunity for Sri Kandi Lintas Iman to this discussion. We are only small organization consisting of ordinary people, but we believe that small initiatives, small activities must be done by every one of us, including women or everyone, and we can make big impact for the condition of women in our world. Thank you.
Yes, interfaith initiatives matters. Absolutely. Thank you very much, Reverend. Thank you very much, Reverend Christy. And now we're going to Ibu Rahmawati.
I would highlight the importance of the inclusion at any level of government, especially the leadership of women in any level of government. So it's very important. And then gender budgeting is very important as well. So the woman could be empowered through the budget. And then the third one is solidarity among the women. So it's very important to, I guess that we all need it to support each other, especially during the difficult time.
That is, I think, what women can do best, inclusion and solidarity. Thank you very much, Ibu Rahmawati. And now for the final one, quick message. We are going to go to Ibu Livia.
Okay, thank you, Bu Sadia. Yeah, I'd like to also second what Ibu Rahmawati has mentioned about leadership. I think we've learned about global women's leadership during the COVID-19 has been effective. Unfortunately, we are the number of global women leaders is not enough. We need to increase that, as well as that, for example, for non-structural agencies in Indonesia, we have had a discussion with other leaders, other female leaders, with the Ministry of Women Empowerment, for example, how to ensure that there are more women leaders, and especially, for example, in LPSK, the agency, 2 out of 7 are women. So that's basically 28%. So a little bit, more closer to the quota of 30%. But I'm saying that we need to learn from what's been done correctly at the global level and also implement it locally and nationally. Thank you.
Yes, learn from best practices and implement, and also for policymakers to really take into account the situations of women. Thank you so much, Ibu Livia, Ibu Rahmawati, Reverend Christy, and Ibu Nancy for a beautiful, important, relevant, crucial discussions. I'm lost for words. There has been many problems that we are identifying, but also addressing some of the initiatives, solutions. I think what is important is that for us, this is not only a discussion. This is a call. Once again, this is a call to action for us to, as Ibu Nancy mentioned, change our perceptions, and also to put women at the center of health recovery, of fighting against violence, of economic recovery during this pandemic, to put women in the center of social, even political issues to make sure that women's voice are heard and their political participations are also ensured. During this pandemic in Indonesia, we're going to have also a pilkada or regional election very soon. So it is very important to place women at the center of policy, any types of policy in response to this pandemic at all levels, at central, central and regional, and also local government, and also by all stakeholders, inclusion of women. Finally, several, not only of women, but also of other marginalized, vulnerable groups. We have to think about minority groups. We have to think about persons with disabilities. We have to put them at the heart as well. Women with disabilities as well. The key words, among others, are inclusion, diversity, solidarity. And with that, on behalf of FPCI and 1000 Abrahamic Circles Project, I thank you for your kind participations and involvement, engagement. I also would like to apologize for any of our shortcomings and for stealing your time with your family tonight. We have gone 20 minutes past 9:30, but I really hope and we really believe that this discussion is worth it and need to be continued. Thank you so much. Have a good night with women in your mind. Thank you.
Have a good night.
Thank you so much. Have a good night, everyone.
Have a good day for Nancy.
Have
a good day.
Thank you so much. We're signing out. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Thank you.
Waalaikumsalam
Good night.
warahmatullahi wabarakatuh.
Thank you, everybody. Thank you.
Thank you, Pak Dino.
Sama